Arrhythmia. Mainly there are atrial arrhythmia or ventricular arrhythmia. Atrial arrhythmia, also known as sinus bradycardia. Basic concept behind the arrhythmia is definition of arrhythmia is it is the deviation of cardiac conduction from normal pathway. Normally heart rate is 60 to 100. We call bradyarrhythmia when heart rate is less than 60, and we call tachyarrhythmia when heart rate is more than 100. Then how to treat the bradyarrhythmia? Always treat the basic cause. If no symptom, observe the patient. BP is normal. If he is symptomatic, in that condition we give the injection atropine. If not resolve the condition, we have to give injection isoprenaline. If not resolved by these two medicines, then we have to uh, fix the pacemaker. Now there is some other conditions like paroxysmal supraventricular tachycardia that start suddenly, stop suddenly. This is AV nodal reentrant tachycardia. In that, any tachycardia that above the bundle of is known as supraventricular tachycardia. In that, heart rate is approximately goes up to 150 to 50, 250, and patient having palpitation. How to manage? Acute management is hemodynamically stable, means systolic BP more than 90. Then we give the vagal maneuver that by giving the carotid sinus massage. Do at one side at one time. This maneuver stimulate vagus, increase vagus, that decreases the heart rate. Then after that, if not resolve problem by these conditions, then we have to give IV adenosine. Instead that, if not resolved, then IV verapamil or diltiazem. If no termination, then we have to give IV ibutilide or AV nodal blocking agent. Then IV procainamide and AV nodal blocking agent, or we have to give the cardioversion. Then second is also ventricular arrhythmia. If when ectopic focus at SA node is atrial arrhythmia, and ectopic focus below the Purkinje fibers is known as ventricular arrhythmia. Now there are wide QRS, where when in ventricular arrhythmia we see wide QRS, also known ventricle ectopic or ventricular premature complex, commonly seen in digoxin toxicity or coronary artery disease. Also, problem is ventricular fibrillation. In that, cardiac is arrest. In that, we have to give defibrillation, that is DC shock. Then one more problem is torsade pontis. In that, increase QT interval. Normally QT is 0.36 to 0.44. Increase QT interval when decrease in potassium, calcium, magnesium, azithromycin. Therefore, not give when QT interval is increasing. Then we have to not give the azithromycin to a patient. Now, in atrial arrhythmia, uh, two major terms are come. First one is atrial flutter, that is continuous atrial depolarization. Atrial fibrillation, cardiac output drops by 20 to 30% because atria aren't contract properly. So, in that condition, we use antiarrhythmic drugs. The Vaughan's William classification for antiarrhythmic drug: class 1 is a sodium channel blocker, second one is beta blocker, third one is potassium blocker, fourth one is calcium channel blocker, and fifth class for others. In class 1 sodium blockers, in 1A the drug name is quinidine procainamide. In first B is lignocaine phenytoin or tocainide. In 1C incanide or flecainide. In class second, beta blocker used in tachycardia, that is tachycardia both in ventricle or atrial. Class third is potassium channel blocker, that is The drugs comes are Berytilium, ibutylide, dofetilide, amiodarone, or sotalol. Now, side effects of amidarones like hypohyperthyroidism. There is lungs pulmonary fibrosis, in myocardium depression. So, in class 5, we use the digoxin, magnesium, adenosine. So that's all about the arrhythmia.